Hello YouTube! That's a lecture about Taussig Bing anomaly, also known as Taussig Bing syndrome. Very briefly, it is named Taussig Bing anomaly because of Ellen Brooke Taussig, and Richard John Bing, two cardiologists who worked together at the Johns Hopkins Hospital in Baltimore, and they were the first cardiologists that described this cardiac malformation in 1949. Taussig Bing anomaly is a cyanotic congenital heart defect. That means a congenital defect that causes blue color of babies because of hypoxia due to decreased pulmonary blood flow. Over here I have made a simple drawing of an abnormal heart with Taussig Bing anomaly. I'm not a good painter. Over here is the right atrium. Let's use another one like this with the superior vena cava here, inferior vena cava, that is here the right ventricle, let's suppose that here is the tricuspid valve, let's say, and here is the left atrium, the left ventricle is here, here the aorta, which originates, as can you see, from the right ventricle instead of the left one. We have malposition of the pulmonary artery as well. Here is the pulmonary artery. Instead of being from here, it's from the left of the aorta. Over here there is obviously the ventricular septum, and here is a ventricular septal defect, which is subpulmonic because it is exactly below the pulmonary artery, just below the pulmonary artery, which is this. This. So the rest is okay. The aorta goes on like this. Here's the pulmonary artery, which is subdivides to the right one and the left one, and here are the pulmonary veins 1, 2, and 3 and 4. Over here you can see the colors. The blue color represents the color of the deoxygenated blood, the red color the oxygenated one, and the purple, it is mixed, oxygenated and deoxygenated. So the main characteristics of Taussig Bing syndrome: double outlet right ventricle, which is this one over here. Can you see it's called like this because it from the same ventricle originate the pulmonary artery and the aorta. It's abbreviated as DORV. That's the double outlet right ventricle. So let's summarize them over here. So it's, as we said, a D, the double outlet right ventricle is the malposition of the pulmonary artery. As you see over here, the pulmonary artery, again, it's at the left of the aorta, whereas that should be from here, should be right of the aorta. So let's write it: pulmonary artery malposition. And there is subpulmonic ventricular septal defect, which is here. It is just below the pulmonary artery. Ventricular septal defect. So the three main characteristics, but there are some more clinical features. We can see a similarity of the clinical features of the dextrotransposition of the great arteries. It's another congenital defect, the DTA. The dextrotransposition of the great arteries, it means that the aorta originates from the right ventricle, whereas the pulmonic artery originates from the left ventricle, and this is dextrotransposition. transposition of the great arteries. It's another congenital defect that expresses the same signs and symptoms with Taussig Bing syndrome. So, cyanosis, breathing difficulty on exertion, exertional dyspnea, low oxygenated saturation. It means that if we take an oximeter and we measure with the finger of the baby or from the foot of the newborn, the pulse oximetry is gonna be decreased. We can see enlarged, mainly the right ventricle, so we have this right ventricular hypertrophy. Underdevelopment, also we can see. We can hear systolic murmur in the left third intercostal space. And we go on. We mentioned 1, 2, 3, 4, 5, 6. Loud second pulmonic sound as well. Second one. Transposed aorta, obviously, as can we see over here. It's from the other side. It's not from the left ventricle. Polycythemia, which is an increased number of red blood cells in the circulation. And the finger clubbing, which is when the fingers turn into blue. This. You can see more pictures by searching Google or some other YouTube videos. So, 6 and other 1, 2, 3, 4. We mentioned 10 clinical features. So the diagnosis, it is done by echocardiography. It's a method of demonstration of the transpose aorta of the also subpneumonic ventricular septal defect, and treatment is surgery. So it's the Rastelli procedure, which we're gonna discuss a bit about it. It has been invented by Giancarlo Rastelli. He was an Italian physician and researcher of cardiac surgery. This procedure contains actually three things which we can mention: the arterial switching of the great vessels, the pulmonary artery and the aura, arterial switch of the great vessels. So let's do this. So this is the aorta, and this is the pulmonary artery here. At the correct position, after it contains a patch over here, a patch, patch across the right ventricle to avoid the oxygenated blood passing from the left ventricle to the right one. So in yellow is the patch across the right ventricle. And the last one is pulmonary homographed conduit, which is outside of the heart. You can see a lot of pictures. I will draw something over here. It's, let's say, a tube or something which originates from here, and this part of um, pulmonary artery is removed, and there is a tube which connects the rest, the pulmonary artery, down to the right ventricle, like this. So the blood, the deoxygenated blood, goes from the right ventricle, which is here, uh, directly to the pulmonary artery, and after it goes to the lungs, and after from the pulmonary veins it is oxygenated, and it goes to the left atrium, and after to the left ventricle, and after it goes to the aorta oxygenated. So the last is pulmonary homographed conduit, which is this. The Let's draw it green. I would like to write homographed, but okay. I will write it over here. So I would like you to leave your comments, and if this video was helpful for you, please subscribe, and thank you for your attention.